Hi, my name is Dr. Alif Musaji, the Smiling Dentist, and today we're going to ask a question. What is private dentistry? Recently, I was invited to become a judge at the Private Dentistry Awards. I was delighted. And it got me thinking a little bit about private dentistry and exactly what it is. It's a conversation I've had with many young dentists, so I wanted to share some of the things that I've thought about. One of the things that's really important to understand is that when patients are paying privately, they could pay any practice. So there is a whole big topic about how we make them feel when they come to the practice. And I think that's one of the important things about the experience that a private patient gets. But I think one of the most important things from a clinical point of view is understanding how much time we spend with patients and where we spend that time. So I sometimes have dentists that will tell me, oh, I'd love to be a private dentist so I can spend more time on treatments. And although in some respects I do accept that, because the last thing we want as clinicians is to be rushed. And I'm afraid to say that sometimes in an NHS environment, that's often the feedback that I get, that dentists feel rushed to see a certain number of patients and to do a certain number of treatments within a certain time, and that cannot be a healthy way to perform dentistry, in my opinion. I certainly couldn't do that. But when I have dentists that come and say to me, I would love to spend hours doing X type of treatment, maybe root canal, and I can have 3 hours to do it, I am acutely aware that we have a human being that we are treating and that we can't be spending hours and hours and hours on performing the treatment. I often say there are some practices which are mixed practices, so they offer both NHS and private treatments to patients. And can you imagine if you are a patient and the dentist says to you, oh, well, you can have the root canal and we'll take an hour doing it and it will cost you X amount of money, or you can spend much more and we'll take 3 times as long doing it. I'll say, hang on a second, you mean I have to pay more money to have pain for longer? Yeah, give me the cheaper one, mate, and the quicker one, please. So when I think about putting myself in the shoes of the patient, it made me think a little bit about where the time should be spent. Now, when I see patients, and mine is, I work in a private environment now, and so where I really like to spend the time is on the consultation and on the decision making and on the planning. So we try and front end all of the investment in time. And for me, it's so important to really understand who I'm treating. Because if I can get into the psychology of the person that I am trying my best to treat, to impress, for them to be happy with what I do for them, then I need to understand what makes them tick so that I can make sure that I fulfill all the things that will make them happy. It helps me then to consent the treatment really well, and I have the time to explain what we're planning so that if maybe I've got that call wrong and they want something different to what I'm recommending, they have the opportunity to say, but what? But why? And then we can have a really nice two-way conversation about these things. And then the other thing is planning. And personally for me, my practice is now limited to implant dentistry, but I want to have all the information that I need, 3D scans, X-ray 3D scans as well. I have everything I need so I can plan where my implant needs to go. I could think about how I'm going to perform a certain treatment, manage the occlusion well. And so every facet of my dentistry that I provide, I really try and think about so that it's delivered then and can be delivered in a very quick and efficient way so that the patient is not inconvenienced with me thinking on the job, because all the thinking has been done beforehand. So actually the practice of the dentistry is slick and patients absolutely love that. And so for me, that is what I think distinguishes us from other practices, whether they be NHS or other private practices. But to me, I think that's the epitome of what we should be doing to look after our patients well. And sometimes as a younger dentist, if you're thinking, I want to have either an NHS or a private career, what does private involve? That for me would be the important thing. The conversation, the consenting, the involving of the patient in their treatment. I think those are the key things. And then once we know what treatment needs to be done, let's get on with it. I hope you enjoyed our video today, and I hope you will join me for more on the Smiling Dentist YouTube channel. And please don't forget to like, subscribe and share. I'll see you soon.